Hi everyone, I'll be talking about Jane Watson's theory of human caring and stroke care. The theory of human care by Jane Watson focuses on the humanistic aspects of nursing care. She emphasizes on the importance of compassion, empathy, and the relationship between the nurse and the patient. According to Jane Watson, nursing goes beyond just physical care. She emphasizes on the holistic nature of nursing care. She addresses the emotional, psychological, and spiritual needs of the patient. Her curative factors, such as the humanistic altruistic values, installation of faith and hope, and building trust, are designed to guide nurses in providing compassionate care. Her theory encourages nurses to create a healing environment where patients feel supported, valued, and cared for as a whole person. Jane Watson highlights the 10 characters processes. These processes are principles or actions that guide nurses in the practice of caring. These processes include promoting a humanistic, altruistic system of values, instilling faith and hope, cultivating an environment of trust and safety, and being present with patients. I'll be presenting a practice scenario showing how I can apply Jane Watson's theory of human caring in stroke care. I have a patient who recently suffered a severe stroke. She has lost the use of her left side, and as you can imagine, this has been devastating for her. Earlier today, she broke down in tears while talking to me. She expressed that she feels like her life is over and she's unsure on how she can live with the changes to her body. She doesn't believe that rehabilitation will help her regain her independence and feels completely hopeless. Today, I'm having lunch in the hospital cafeteria beside from Jane Watson in a quiet corner. The cafeteria is bustling with nurses, doctors, and staff during the midday break, but we've managed to find a peaceful spot to have an important conversation. Just before we started this chat, I had a very emotional moment with one of my stroke patients. She had just finished crying and expressing how much her life is going to change because of the stroke. Now I'm reflecting on that conversation with Jane as we talk about how to apply her theory to support this patient during her recovery. Firstly, I would ask Jane how I can use her curative factors to help my patient who is grieving the loss of her independence and feeling hopeless about her future. I'm asking this question because it's important to acknowledge the depth of my patient's grief and loss. The curative factors focus on cultivating a relationship that is grounded in empathy, presence, and respect. By practicing loving kindness and presenting an equal relationship between I and my patients, I offer my patients a safe, compassionate place where she can express her feelings without judgment. How do I approach a patient who is emotionally withdrawing from the rehabilitation process, especially when they feel that the changes to their life are permanent and devastating? I'm asking this question because I want to help my patient create a healing environment. An environment where I validate her feelings while also offering encouragement. I want to be able to engage my patient with compassion and help my patient reconnect with her sense of worth and ability. I want to support her in understanding that rehabilitation is not just about regaining physical function, but also about emotional and spiritual healing that helps her regain independence in her life. In a busy hospital environment where time is limited, how can I still apply the curative factors to provide emotional support and build trust in my patient? I'm asking this question because time is very limited in a hospital environment. But I think it's also important to be fully present in the moment, even if it's just a few minutes, by sharing eye contact, offering a comforting touch, or asking how my patient feels. I think these small actions foster trust and show that I see my patient as a whole person. What strategies can I use to incorporate family support in a way that aligns with your theory of healing and caring? I'm asking this question because family is an essential part of the healing process. The importance of a caring presence cannot be understated, especially on the road to compassionate support. My role as a nurse should be to empower the family to nurture that connection and share in the part of the healing process. How can I instill a sense of hope in my patient who is overwhelmed by depression and despair, especially when she feels that her life has changed forever? I'm asking this question because I understand the importance of transpersonal caring relationships. As a nurse, my role is to be a beacon of hope for my patients by continuously offering love, compassion, and trust even when my patients can't see the way forward.